today because I couldn't get the PowerPoint to work. That was probably my fault. I'm not very good at technology, so you'll just have to listen to me talk for a little bit. But it gives us the opportunity to make it a little more interactive, so please interrupt me at any time and ask questions. I'd prefer it that way anyway. But thank you, Nicole, for introducing. Like she said, I'm Dr. Barker Booth, and went to medical school and then did a residency in family medicine, and still wasn't satisfied with the way healthcare was going, so I'll kind of get into where I went from there. But the whole reason that we started this clinic was because I had a personal struggle with obesity, and about 7 years ago started a journey to losing 100 pounds, and figured there were a lot of other people in this country also struggling with it, so went and got additional training called a fellowship, and that was specifically for weight loss and obesity medicine. So about a year ago, my husband and I opened a clinic. We were both kind of burnt out with our other jobs. I was at the time in the hospital and front lines with COVID, and he was an electrical contractor, and he was getting burnt out too because he couldn't get supplies. So we said, we're just gonna abandon our other careers and start this clinic. And interestingly, and he's given me permission to say this, he suffers with something a little different, and he has a testosterone deficiency. So once we got him figured out and diagnosed, I went and did additional training in hormone replacement therapy. And very interesting, the two actually go together really well, weight loss and hormone optimization. And once I got training in that, we started the clinic. So we've been doing it for about a year now, and we have just over 1,000 patients, which apparently is pretty good. We don't know because nobody does private practice anymore, so we're thinking we're doing okay. But currently it's me, and we have a physician assistant that is also helping to see patients, and we're looking to hire a nurse practitioner soon. And we have 2 nurses right now, and we're looking to hire a third one of those. And we're doing a lot of weight loss and hormone replacement, and we're starting some IV nutritional therapy here very soon. That's very popular. And my partner, our physician assistant, does a little bit of aesthetics. I don't get into that too much, but she does a little bit of Botox and fillers. And once people lose weight, they want to do other stuff, so it kind of fit in pretty well. So, any questions so far?
How does it work?
Great, okay, perfect, perfect. So, to become a patient at our clinic, 2 ways. You can call the office or go online, make an appointment. Most people will come do a full 1-hour consultation with me or our physician assistant, and we'll go through your entire medical history, and we'll go through an extensive list of symptoms, like how do you feel? Do you feel okay? And that's something that we're doing that's a little different than some of the other practices, because they will just get blood work and fix your blood work. I've said for 15 years before I did this, I was really good at making people have pretty blood work, but nobody ever felt better. And I just felt like that was an area that was being missed. So we'll do an extensive symptom review of what is bothering you. And then we do typically do some labs, but they're a little different than what you would traditionally have. Most family doctors are getting your cholesterol, the diabetes screen, but we're doing like a full thyroid panel, and we're checking for insulin resistance. We're also looking at some vitamin deficiencies, and then we bring you back for a follow-up. We'll go over all of your blood work and talk about, hey, this is off. This could be explaining the weight gain or why you're feeling so tired, and then we fix it.
So let me ask my question better.
Okay.
How does it work scientifically?
Okay, so it depends which you're referring to. So hormones, scientifically, the biggest hormones that we're dealing with are thyroid, the sex hormones, so estradiol, testosterone, progesterone, insulin, and cortisol. When those get dysregulated, any of it can lead to weight gain, and that's why the combination works so well. So we'll diagnose the deficiency or the dysregulation and then fix it. And then, of course, we have dedicated weight loss medicine too, which a lot of people will use both, really.
What were those that you said? What were all those you said? Cortisol?
Cortisol, thyroid, insulin, and then the sex hormones. Yes.
Yes. Are you familiar with Ozempic, and if so, what's your thoughts?
Yes, I'm glad you brought that up. I actually think that class of medicines is fantastic for weight loss. I've done weight loss medicine, not in this clinic, but just with other big companies for 7 years. There has never been anything this effective. So we actually do have a compounded version, because Ozempic, if you know anything about it, it's about $1,300 a month. It's a mortgage payment. And most insurance companies are not paying for it, So we've been able to find a compounded version of it. We're not allowed to call it Ozempic, we just have to call it semaglutide. But we have over 300 people using it right now, and they are all successful. It is incredible. I've never seen anything like it. So there is a safe way to do it. There's a lot of negative publicity about the medicines, but when you prescribe it the way that the manufacturer is recommending it, it can be very unsafe, because these are a lot of times non-diabetics using a diabetic medicine. But we have our very own dosing schedule, and we individualize it to each patient. So we're able to do it safe, and it's very, very effective. Yes.
So with those medications, is that something that they have to stay on long term? Because I keep reading about patients coming off of it and then quickly gaining the weight back.
Right, great question. Most of the time they are able to come off of it. The one thing we're seeing that's fantastic, it's teaching you how to make lifestyle changes almost automatically. Now we're happy to supplement, that information too. But most people are making these lifestyle changes just because the medicine is teaching them to. And it does that in a few ways. It does regulate insulin levels. And when your insulin is in the normal range, you're not gonna have the cravings for sugar and sweets. And it is gonna suppress your appetite as well. So as long as you're able to continue those lifestyle changes, you can come off the medication. Interestingly though, when we put people on it, a lot of people say, I feel so good, I don't ever wanna come off of it. I want to use it long term. And we're okay with that. It's better than them regaining the weight. But a lot of people feel better when their insulin is down to a normal range. Did you have a question?
Yes. So two questions.
Sure.
Is this covered by your insurance? And then second question, so when I'm listening to this and like the Ozempic.
I'm sorry. Great song.
Are you familiar with when FinFin was out, when they had the?
Yes.
So is this similar to that type of diet or I guess lifestyle change? And if so, how's this healthier?
Great questions. So insurances do not cover it a lot of the time. I've argued with them for years, and I keep telling them, you're willing to cover all of the problems that obesity causes, the diabetes, the high blood pressure, you'll pay for all of those medicines. Why won't you cover the underlying cause and fix it? And I mean, I'm not obviously getting anywhere with them. So typically they don't. Every now and then we'll hear about an insurance company covering the medicine. But then the next barrier is finding a physician to prescribe it, because a lot of them don't believe that you should take medicine to lose weight. So, which I know, again, also a problem. This medicine differs than Fen-Phen. Fen-Phen was a stimulant, a very powerful one, and it's off the market now because it caused heart disease and really the cardiomyopathy, meaning that your heart got bigger and stopped working. So this is completely different. This works on the hormones that cause you to feel hungry and cause you to feel full. So far superior and far safer.
So one
Sure, anything, yeah.
So so it sounds like this is some form of, it'll treat the hormones.
Yes.
But for women who are perimenopausal, menopausal, does that increase your risks associated with like cancer with some drugs that impact hormones?
That's another great question. So the semaglutide does not affect cancer risk at all. The only way you couldn't go on it is if you have a history of thyroid cancer, because they found at very high doses in lab rats it was causing thyroid cancer. But as far as the cancer associated with sex hormones for women, you're probably referring to a study done in the 1990s. It was called the Women's Health Initiative. And they took a bunch of postmenopausal women, far past menopause, and put them all on a birth control pill called PremPro. Right, and then they couldn't figure out why that caused so many problems. Right. PremPro, by the way, is off the market because it was deemed so unsafe. They had to terminate the study early because they were finding increased risk of cancer and increased heart attacks and strokes. So what we do is a bioidentical replacement, so it matches what your body was making before. PremPro is a combo of pregnant horse pea and a progesterone that causes abortions. I'm not kidding, right?
Please.
So you can see why that's very different than what your body was making. Yeah, that's where it comes from. Yes. Yeah, it's very different, yes.
So I've heard of folks using Ozempic along with topiramate, naltrexone, and Adipex. Are they meds that you use, or are they, what are your thoughts
Yes.
about that?
We
Those
don't use all of those together,
Mhm.
but we have used all of those individually. Adipex and topiramate actually is a really good combination, if you can tolerate the side effects. Those two, they do make that in a brand name called Qsymia. That one I believe is $800 a month. Separately, we just prescribe them separately, and it's much more affordable.
Mhm.
The only medicine we usually will add, like if the Ozempic isn't doing everything we need it to, sometimes we'll add metformin, which is another diabetic medicine. It also works on insulin, but through a different mechanism. So the combination seems to work on insulin from two different ends, and it's a little more powerful. Did you mention one other?
Naltrexone.
Yes, so that one, we do a little bit of it. I don't find that one to be quite as effective as the other options. People with like a true binge eating disorder will benefit from it. That is when at nighttime you're eating 10,000 calories all in one sitting. So that's a psychological type of eating disorder, and the naltrexone will help for those types of patients. So we use that one a little bit, and in that population it's great, but otherwise I don't find it to be very effective.
Mhm.
Yes.
You had mentioned about how many doctors won't prescribe the medications. So I'm wondering, do patients only stay with you for so long and then they transition back to their family doctor or an endocrinologist or something, and that's when all of a sudden they can no longer get the medication?
So right now, and it's only been a year, we haven't really had anybody leave, unless we have had a few people say, well, my insurance is gonna cover it, so I'm gonna go explore that route. Totally get it. Yeah, I mean, if you can get insurance to cover it, please do. But what I hear every day is that they go back to, or they're coming to us from an endocrinologist or a family doctor because they're not being listened to. And they express concern with their weight or just not feeling well, and they're either not getting a diagnosis or they're being ignored. So usually we retain people once they come to us. So we haven't had anybody leave because we fixed them up and then they go. So yes.
That's kind of along the lines of my question, but maybe, so how does it work? Are you writing the prescriptions? Are you the prescribing doctor, or are you making recommendations back to the doctor? How do you work
Great
with
question.
the?
Yeah. So the semaglutide that we get compounded, we actually keep it in clinic. So we're actually providing it directly to patients that come in and decide this is the route they want to go. A lot of people are already aware of it, and some people come to us knowing that we have that and that's what they want. So we can do, the nice thing is we do the training for it because it's an injectable, and a lot of people aren't comfortable with that, but we can do their training right then and there at their visit. So occasionally I'll make recommendations if people want to stick with their family doctor or endocrinologist. Occasionally I'll make recommendations. Sometimes, especially if they have more than one thing going on. Usually when it's weight loss, the family doc and the endocrinologist are very happy to say just have her do it. They don't even want to mess with it. But if they have like a thyroid dysfunction on top of it and they want to stick with their endocrinologist, I've made recommendations that way.
And then one other question.
Sure.
It's a lot of talk about the hormones and
Yeah.
medications. Is there an exercise component? Is there?
Sometimes we'll add that later. So
Okay.
our typical protocol is the first 2 months, you just take the medicine and see what happens. Typically in those first 2 months, people are already making a lot of the dietary changes because they just feel very different. Again, they're not having cravings and their appetite's decreased. And then we add the exercise component a little later. Some people, once they start feeling good, they want to go like P90X, and that can be counterproductive. Yeah, they get real crazy, and then their cortisol levels go up, and then they struggle a little bit. So we actually advise in the beginning when you're losing weight to just easy stuff like walking and yoga, and then we can add the P90X down the road. But yeah, we will do all the lifestyle counseling too. It's just very interesting that once people see that little bit of success, they're usually doing it on their own. Most people already know what to do. They just need a little boost. Yes.
So have you experienced folks, so I'm on kind of my own process, when people reach like a plateau, how do you get people past, so I'm at 115 pounds and I'm stuck there. How do you get past that?
So the nice thing with the semaglutide, the way we've done the dosing, is there are 25 different doses that we will have people use. So we start you on the lowest, and when people get to a plateau, you just bump up to the next dose. So we very rarely have people with that plateau that we can't get them past.
So your stuff is primarily medication. and-
Sometimes we'll do the dietary interventions. If we're to that point where they don't want more medicine, or most people just want to increase their dose, honestly.
Okay.
It's easy, right? But sometimes, yeah, we will do lifestyle, and one way is to decrease your carbohydrate intake by 10%. Another method that we sometimes recommend is intermittent fasting. And then there always is the option to increase activity, but it's not quite as effective as making those dietary changes. Yes?
What are your thoughts about Ribelsis, the oral form?
Ribelsis is just as effective. It takes a little longer to work is what I'm noticing. The problem with that is you have to be diabetic for insurance to cover it. Plus you have to get multiple prior auths. So it's not FDA indicated for weight loss. And I think that one's $800 or $900 a month if you're gonna pay out of pocket for it. But it is semaglutide. It is.
I thought it was the same thing.
It is, yep, it's the pill form, but we just don't have access to it. The pharmacies we work with that are able to make the medicine don't make it in pill form. So we're kind of stuck with the injectables. Yes?
Since a lot of us work with seniors in the room, can you
Yeah.
talk, and most of us are close to 40, just close. Just a few of us. Or a little lower. Can you talk about when you're meeting with patients, some symptoms that you go over and some of the things that you ask to see if there is a hormonal imbalance, and kind of where you would go to start adjusting that to make them feel better?
Yeah, sure. So the first screening we would do would be thyroid. And symptoms of a low functioning thyroid would be fatigue, like to a point where you're sleeping 10 hours a night and you can't get up in the morning. Cold intolerance, constipation, heavy periods, hair loss, dry skin. When we screen for insulin resistance, we ask about just never feeling satiated, meaning like eating a full meal and saying, I am still hungry. Or having those cravings for sugar, sometimes salt, the carbohydrate foods. And even feeling tired after eating a big meal, sometimes that indicates insulin resistance. And more abdominal weight gain. People with high insulin levels tend to gain more around their midsection. For sex hormones, it's different for men and women. Women, we will screen for like menopause, which would be the hot flashes, night sweats, brain fog, low sex drive, constipation again can happen. Even just more anxiety and mood changes happen with it. For men, it's a little different because we're only talking about one hormone, that would be testosterone. You guys are a little less complex, but you probably already figured that out.
Thanks for coming.
I know. Low testosterone, sorry, go ahead.
Go ahead.
Low testosterone would be really just, a lot of men notice the decrease in athletic stamina if they're going to the gym. They're like, man, I can't make the gains I was making. I'm really tired. I'm having trouble sleeping. So we'll screen for all of those things. Did that answer?
Yeah.
Okay.
Okay, so we do work with a lot of seniors.
Yes.
I've seen, so two things. So number one, I've seen a lot of these hormone type clinics that only work with women. But
Yes.
yours is both sexes.
Absolutely.
That's
Yes.
awesome.
Yes.
But if we have clients that are truly seniors that are dealing with a lot of things, is there a minimum or maximum age for your program?
No. I think our youngest hormone replacement, our youngest weight loss patient is 12. Our 12-year-old has one of the worst insulin resistant cases in our clinic. For the sex hormones, I want to say our youngest is early 20s, and then our oldest would be in her 80s.
Awesome.
So, yeah, we
Awesome.
do things differently, obviously,
Sure.
depending on the age, but yeah, we try to accommodate anybody that needs it.
Okay. And if someone needs to be on semaglutide and their insurance doesn't cover it, what's your cost to your clients?
So we do, pretty much everybody gets a membership fee. What that covers is unlimited office visits. We also provide a cell phone number, because when you're talking about weight loss, you need real-time advice. You know, it doesn't take more than a day to get off course and kind of give up. So we will text our patients on a daily basis if we need to. And then we have a support group that they're invited to and unlimited other resources. And then the medication's all separate. So the semaglutide at our clinic is $300 a vial, but that's lasting people about 2 to 3 months.
Okay.
So it's still expensive, but it's
Yeah,
way
but it's
different.
not
on a-
$1,300
It's not a
month.
mortgage payment, right?
Right,
Exactly.
right, that's awesome.
Is this like a one-time membership fee, or is this like a annual membership fee?
It's a monthly fee. We can do it as an annual, but it's $75 a month, but there's no contract. So if you feel like you don't need our services anymore or that you've completed the program, you can stop it at any time.
Okay, I'm piggybacking.
Yeah, no, that's good.
What if somebody is like an avid runner, an avid swimmer, an avid biker, I mean, and then you ask them to just stop cold turkey still?
No, so that's very different. If your body's already acclimated to that type of activity, your cortisol's gonna be balanced. It's people that have sat on the couch or just have a very sedentary job, and then they start to feel good and then they jump into P90X, then your body's gonna respond to that negatively. But if you're already used to doing something like that, I would never ask you to change that. Yes.
So, do you become the primary care physician, or do they keep their primary care physician?
Most patients will keep their primary care physician. We're just kind of supplementing the stuff that primary care physicians aren't comfortable with. But a lot of our patients already have, high blood pressure or high cholesterol, so typically their family doctor will keep managing all of that. We're just supplementing with either weight loss medicines or hormones. Did you have?
Yeah. I think you already answered it, but I just want to make sure.
Sure.
So I know from my experience that and like you said, a lot of doctors don't like to deal with hormones. They don't even want to talk about menopause at all.
Right, I know.
Very frustrated.
Yes, it is.
So with the individuals, maybe they're not interested in losing weight, they either don't need to,
Yeah,
or
right.
they're not interested at the time. Can they
Yes.
just come to you for hormone replacement?
Absolutely. We probably have 25% of our clients are just there for the hormone component. Yes, they don't need the weight loss. Most of our guy clients honestly are there for the testosterone. And yeah, same way. Any man that's we have a 27-year-old right now, his testosterone is non-existent. And of course he couldn't get anybody to help him, even though it was flagging as abnormal. They're like, you're 27, you don't need it. I'm thinking, you need it more than you know what I mean? Like, he's trying to get married and he's struggling because of it. But he, didn't need the weight loss part, he just needed the hormones. And we have probably more women going through menopause that saying the same thing, like, nobody will listen to me, I'm miserable. And we're happy to do that.
Do you also prescribe testosterone for women?
We do, absolutely, yeah. It's, if I had to pick one hormone that benefited women the most, believe it or not, it would be testosterone. We are seeing incredible benefits with it. Pain relief, energy, libido, motivation, mood improvement. It's been awesome.
Does insurance usually cover that?
No, they consider testosterone for women experimental, unfortunately. We make
Even though it's in our body.
it's a much smaller amount than men, but we do need it, yeah, yes.
I'll make a plug for that specifically. So my mom flies in from Texas to see her. She threatens to bring a busload of 70-year-old ladies with her every single time. But she had early hysterectomy in her 40s and has had hot flashes and post-menopausal symptoms since then, like significant hot flashes, moodiness, fogginess, all of that. And she came and got some hormone replacement, and she's like a whole new lady. I have a bunch of selfies to show you, by the way.
I can't wait to see it.
So I would say that's all she comes to see her for, but she loves her. It's worth a trip from Texas.
Wow.
And not to see me.
She benefited so much from, yes, she did.
Okay, I have another question.
Yeah, please.
What's the difference between you and Be Balanced, let's say?
So that is a great question. Be Balanced does not have a physician, so they aren't doing any prescription medications. I do believe they do I think they do a progesterone cream. There is a very low dose that you can get over the counter. I believe that's the only amount of hormone they're dabbling in. Otherwise, they teach you to make dietary changes to help improve your hormone levels.
And what do you say to somebody that comes into your office and is completely skeptical and says, I run, I exercise, I eat right, but I'm not losing weight. Is there anything that we can do in that realm before I take a pill?
Yeah, absolutely. I recommend a lab workup. Let's check your thyroid. It's probably never been checked to the capacity we would check it. Let's look and see if you're insulin resistant. Even though it's uncommon in people that are that active, we see it every day. We'll look at sex hormones, you know, that's happening early and earlier. 50 years ago, our hormones should be solid until we're in our 60s. And again, we have people in their 20s that need replacement, and it has to do with the way our foods are made, honestly. All of the processed and some of the oils that we're frying foods in, it depletes the hormones. So likely when people are doing everything right, and a lot of our clients are, there's something else going on causing the weight.
And how about your consultation fee and for the lab work, what is that?
Yeah. $200, that's for the hour visit and the follow-up visit. And we have been able to get insurance to cover all the blood work.
Oh, nice.
How soon can I make an
We brought our tablet along today. We can get you signed up today.
Go ahead.
So I just have a question.
Yeah.
Obviously, there's, a lot of, and this is showing my age, but the whole hormone replacement thing
Yeah.
and this bioidentical
Yes.
versus, can you talk a little bit about and explain why you feel like these are much safer and for
Yes.
whatever reason?
Yes, so they did start to do research back in the 1940s on bioidentical, and the results were incredible. It showed no increased risk of cancer. It actually showed benefits as far as preventing osteoporosis, preventing heart disease, preventing strokes. And if you think about when our generation does really struggle with those diseases, it's after menopause or after andropause, which is the male version when the testosterone decreases. Unfortunately today, any type of research is funded by the big pharma companies, and there's a loophole in the law, they cannot profit off of a identical component to what your body's making. So why would they fund research where they can't make a pill and make money off of it? I mean, I get it from an economic standpoint, but I believe that's why we don't have any current research on it. Again, we're using stuff that was done in the 1940s, but that evidence is very clear that it is safe versus taking something that is chemically different. You have hormone receptors all over our whole body, not just in the reproductive area. So birth control, the best example, Prempro, it's great at preventing pregnancy because it works differently. The chemical structure is different and it will shut down your reproductive system. But that doesn't account for the estrogen and progesterone receptors in your brain or on your heart. So when you give your body something that it was producing and it's matching what that is, you get benefit and really no negative side effects. Did that answer your question?
Mm-hmm.
Okay.
So
Did you have another? Yeah.
Be Balanced, how about Your Best Life MD? I don't know anything about them, but I just happened to see them the other day.
Yeah, so they do the hormones. I believe they're very similar with their hormone replacement.
But they only do ladies.
No, they don't.
No?
No,
Didn't
I know the
matter.
owner,
And
no.
that's what I just read their signs, it was all about women, so I
Mhm.
made assumptions.
No, they do a lot of work with bodybuilding.
Yeah, I thought they did.
A lot of work with,
Yeah.
with lifting.
I don't know how comprehensive their workup is, and I know they're not doing any of the weight loss stuff.
Okay.
And I don't know if they do any thyroid or insulin resistance. I know they definitely do the sex hormone component though.
Okay, cool.
Yes.
So, you might have already said this, but for person that is post-hysterectomy, what are your thoughts for the estradiol patches?
Some of them are okay. If you can find one that's bioidentical, I think they can help with some of the brain fog, hot flashes, and night sweats. My concern with only replacing estradiol is that you're missing all of the benefits of progesterone and testosterone. So they can help to some extent, and some women, that's all they need. They just need that little bit of help to prevent, the hot flashes, night sweats, and brain fog, but you're not getting any of the anxiety and mood control. You're not getting any of the energy benefits. Sometimes the combo of estradiol and testosterone will help with abdominal weight. So those benefits, you're only getting a little piece, and women produce 3 hormones. So to replace one is just, in my opinion, it's not optimal.
So I have, it's an economic question.
Sure.
Right? And this is very interesting to me because, I'm at the upper end of this age group here. So if I wanted to budget to come and see you, I need to pay $200 is the workup and the sit down, and here's what you would benefit from,
Yes.
Lisa.
Yes.
Then what? I pay $75, then you
Yes.
come up with a regimen for me?
Yes.
and then whatever the replacement things that you decide that I need, that's mostly out of pocket?
It's all out of pocket, unfortunately. Insurance companies just don't pay for this type of medicine.
So even if it's not weight loss medicine, even if it's hormones?
Still experimental, yeah.
Gosh, we've been experimenting on women so many years.
I know.
Let's try this. Oh, it'll make your teeth fall out. Oh, sorry.
I know, yeah.
Okay, so that would run,
We're
what's
less
like,
than cable. That's what I've had people say, well, how can we afford that? I'm like, can you afford cable? I mean, for about less than $200 a month.
okay,
for
and that
one
includes,
service.
and that's the $75 too?
Yes.
So if I were going to budget this all in my head for less than, 200 times 12.
Unless you need weight loss, because they're like $900 a month.
Ours are not.
Okay.
Ours are much more affordable. Ours end up being about $100 a month for the medicine, I say on average, and everyone uses it differently. But if you're doing one service, you can say under $200 a month. That includes the medicine and our service. If you add a second service, let's say you want hormones and weight loss, you're looking at $200, $250 a month.
Okay.
For everything.
Yeah.
Yeah, no, that's an important question.
And if I got my female part hormones kind of regulated, which we know that they're all out of whack anyway.
Yeah, mine are too, so.
Crazy person. Is that likely to, like, the weight loss kind of piggyback on that, or that's?
The combo's even better. If you do like a weight loss medicine and the hormones, the combo is fantastic. To do the hormones alone, it's very slow. Women are benefiting, but it's not, I would say most of us want a little more instant gratification than what you're gonna get. We're talking, a couple pounds a month is what you'll get just from hormones. So most people do the combo, and it does work even better.
Still cheaper than New York, is it?
If we get a group discount, maybe?
We'd be open to that. I mean, I think we'd be open. That's his territory.
I'm not the speaker today.
Have one group appointment.
I'm good with that.
Could you really onboard 30 people at once?
Yeah,
I know. I didn't
If
really
we
mean
designate
that.
a whole day.
I know. Fear got into you. Other questions, guys?
Her office is in Shiloh.
Yes, and you can make an appointment by calling, or if you know anybody that would be interested. And we do have handouts on the cost too. If anybody wants a handout, just to refresh everything, that we brought that along. But you can also make an appointment online right from our website as well. Very, very easy.
So tell us about a really big success story, and also tell us about not a success story.
Okay. Feel free to give me an example. I'm trying to think of.
Lauren?
Oh, yes. So, okay. We have a patient that, I'm trying to think what her starting weight was. Her main goal, she came to our clinic, she's 36 years old. She said, I've been trying to get pregnant for 5, 6, 7 years now, and I've seen 12 different doctors. I'm probably exaggerating a little bit, but nobody can help me. And I'm to a point now where they won't even do this test I need called a hysterosalpingogram because I'm too heavy to fit on the table, and they won't even do it. And she said, so my goal is to come lose weight, get pregnant, and then I'll come back and deal with you guys another time. But that's my main goal. Once I'm pregnant, I'm out. So she's lost 60, 70 pounds.
Yeah.
Something like that. And she actually did get pregnant on her own now without any help of fertility. She did lose that one. But they told her this is common, you're still losing, you're still adjusting. But her biggest issue was insulin resistance. And they were just treating everything else and not treating the insulin resistance. So when we put her on semaglutide, it fixed the underlying issue. It fixed her insulin level, and on top of helping her lose weight. So she's very, very hopeful, and I mean her other doctors, her fertility specialists, are very hopeful. She's getting the test done now because she meets the weight requirements. So yeah, she's one of our better success stories. Trying to think of
Tony.
Okay, so we do have a not so successful. She another patient, she was probably started around 300 pounds, and she had heard about the semaglutide. She came specifically for that, said, I've been TikToking the crap out of this medicine. I know exactly what it is, and this is what I want. So we put her on that, and it didn't work as quickly for her, and it was very, very slow. And I wouldn't call it a complete failure because we never got her to maximum dose. We didn't get to add all of the, sometimes we'll add metformin, sometimes we will implement lifestyle changes. What we say is, we give you a cell phone number for a reason. If you're struggling, let me know right away. This is a good example of, she showed up 2 months later and she's like, well, I'm not losing, so I'm gonna be done. And yeah, and I said, well, this is the first I'm hearing that, so maybe next time reach out a little sooner. So people that are really doing their follow-ups and reaching out when they're struggling are doing fantastic.
Great. That is a perfect example.
You keep saying semaglutide. What are the side effects of semaglutide?
Great question. So common side effects, the most common would be nausea and constipation. They're usually very mild because the way we do our dosing, which is different than the brand. So brand being Ozempic and Wegovy. We've come up with our own dosing schedule. You've probably heard horror stories about people being deathly ill and having to stop the medicine. We start very low and we go slow, and we only increase dosing when people need it. We haven't had to stop anybody from the medication due to side effects, thankfully. Occasionally people will say, oh, I got a headache after my first 1 or 2 injections. Some people feel a little tired. Those are usually very temporary. They're very minimized, very minimal side effects, and we're able to get people through them usually.
This is all experimental, so as far as long-term research, what's out there?
So for the semaglutide, is that I'm assuming referring to that or all of it?
Honestly.
Yeah. So the hormones, again, 1940s is the last time we've had research on those, and they're not conducting current studies on it. So, which is why they say experimental. The semaglutide has been in a class of medicines that's for diabetes. It's been around for 50 years. So we know we've had diabetics on these types of medicines for 50 years with no long-term complications. The semaglutide itself is new, and we just started using it for weight loss about 1.5 years ago. So we don't have long-term studies on that particular one, but I think based on, we've had, again, diabetics on similar medicines for a very long time, and they've done fine. But the rest of it, yeah, it's considered experimental, and it will be until somebody does research, yeah.
On average, how much weight are you seeing people lose, like monthly or whatever those checkups are?
Great question. So it depends. Everyone's very different. We have people losing 3 pounds a week very consistently. We consider a 1/2 pound to 2 pounds a week about average. It is supposed to be more slow and steady. Rapid weight loss is dangerous, so we do not recommend fast weight loss, but I would say 1/2 pound to 2 pounds is about our normal.
1/2 pound to 2 pounds a month?
Sorry, a week.
Thank you.
A week, yep. Any other questions?
Thank you so much.
Thank you for having me.